brain. So yeah, now you can start.
Got it, I got it.
Flip it.
Oh, no, it's like,
Flip it.
nowhere toward the ceiling.
And turn it around so that the microphone stays facing us.
Oh, okay, so
Perfect.
okay, my bad.
Yeah. All right, so we are going to start. Folks apparently will come in when they decide to come. So today we are going to finish up this particular section about all the structures of the central nervous system and the peripheral nervous system. So we finished by looking at the organization of the spinal nerves, where the spinal nerves come from, how they are formed from the spinal cord. We are then going to talk about nerve plexuses, where the named nerves come from. Then we are going to talk a little bit about reflexes, because you're going to be testing reflexes today in lab, along with slicing a sheep brain and testing some cranial nerves. And then that'll be it for this particular set of slides. Then we're going to move to the next set of slides, and we are going to start talking about the neural tissue. We are then going to start hopefully setting up for the resting membrane potential and the action potential, so that we can move nerve impulses along the nerves from the brain out and from the out in. So that's where we are. That's where we're going. So now we are going to get started. So again, this is where we ended, looking at the organization of the spinal nerves. Now, one of the things about nerves that we know is that, in general, they do not undergo mitosis. So if you lose or damage a nerve and a nerve cell, you're not going to get that replaced. So yesterday, when I got home, I got the little, I don't know how I got on these people's mailing list, but the Med Center, Advancing Health, and the cover says, "Cadaver nerves restore gamers' severed fingers." So there's a little article about this girl. This is the article. It basically says nothing, right? I thought it would. I didn't read it before I brought it, but the idea is that she was using a table saw, right? If you know anything about a table saw, you put the boards down and then you push it through. She was wearing gloves. Not a good idea, because the glove got caught in the saw, pulled her hand into the saw, and as it says here, they weren't full amputations, but they were one step away. She had severe lacerations to 3 of her fingers, with the index finger basically amputated, and damaged arteries to the 3rd and the 4th finger. So what they did apparently was to reestablish connections across the lacerations or the wound with cadaver nerves. So and the whole thing about the cadaver nerves they did in one sentence. It says, in an innovative approach, Dr. Morgan used cadaver nerves to replace the damaged ones. So, doesn't say anything about how you hook them up on either end, but apparently it now works. So, my suspicion is that she does not have perhaps 100% function back. However, as it says, she occasionally has sensitivity issues and grip problems, but she's been doing a lot of therapy, and if you want to take a look at this, you are more than welcome to. Unfortunately, it's just a little pamphlet that goes out to the general public, so they didn't put any sort of gory details in there, but kind of cool. that it is new and innovative. They're doing it at the Med Center. So there was the hand surgeon. So, but I don't know. I mean, they have been able to reattach like arms and fingers with that have been fully amputated. However, there is usually some sort of neural deficit because there are just some things that we can't fix. But kind of cool and related to what we were talking about. And I thought that was nice timing, very nice timing. So those would have been nerves that came from the spinal cord, right? Because remember we talked about two different kinds of nerves. Cranial nerves come directly from the brain, and the spinal nerves, the 31 pair of spinal nerves come from the spinal cord, right? Now, as you can see right here, we have all of the cranial, thoracic, lumbar, sacral, and the coccygeal nerves. But they come out and you notice that they create sort of this little network here. It's not just the nerve comes straight out and then branches. It comes out, it branches, and it joins with other nerves that have branched. And those are called plexuses. So a plexus is a network. Think of like the bags at the grocery store that you get with the little tiny oranges in, right? They're netted. That is what a plexus is. It is a network. And these interweave. So we are taking some neurons from one branch, adding it to neurons from a different one. Some of those neurons are going to branch again, join somebody else. But these are from the anterior rami, right? The rami. Now, you've actually seen this word before, although it was ramus. Ramus just means branch. So the plexuses are formed from most of the anterior portion of the spinal nerve. So if you remember, we had the spinal cord, we had the anterior nerve root, we had the posterior nerve root. They came together to create that spinal nerve. And then on most of them, the anterior portion is going to then create these plexuses. Now, the plexuses will then split into the named nerves. And you have a list of named nerves that you need to know. There aren't that many, right? Now, there are four principal plexuses. We have the cervical, the brachial, the lumbar, and the sacral. If we're looking at this, what area do we not have a plexus in? What's missing? What? Thoracic. Yeah, there is no plexus in the thoracic region. And there's no plexus for the thoracic spinal nerves because they're basically just going to your rib cage, right? To the bones, to the muscles. Anything that is inside of your thoracic cage, nerves will be coming from somewhere else, okay? So we are going to look at these four plexuses. We're going to start here with the cervical plexus. Please do not worry about the colors, right? Don't worry about the colors. What you need to know, number one, is that the cervical plexus includes branches from C1 down to C5 plus 2 cranial nerves. 11 and 12, the accessory and the hypoglossal. So those 7 nerve branches, we can see they're going to split, they're going to join, they're going to split again, they're going to join, they're going to split again, and ultimately from all of these endings here, those would go out into your, like your neck region and the sort of the superior portion of your thoracic region to innervate those muscles and other organs. Now, from here, there is one named nerve that you do need to know. It is known as the phrenic nerve. The phrenic nerve goes to your diaphragm. Phrenic nerve goes to your diaphragm. So this is actually coming from your cervical plexus. So if you damage your cervical plexus, you may have issues with your diaphragm. Now, remember, this is on both sides. So you do have two phrenic nerves. You have two cervical plexuses, okay? One on the right, one on the left. But again, please do not, you can look at the color coding and read them later, but do not memorize that stuff, okay? So we have our cervical plexus, then we have our brachial plexus. In the brachial plexus, this is part of C5 all the way down to T1. So it's C5, 6, 7, 8, and T1 branches from those spinal nerves. Again, you're gonna mix and match, and they've got trunks and this and that and all sorts of things. But if we then look at the ends where we can see right here, the brachial plexus aims to go towards the brachial region. So this is why those nerves that are bolded, like the ulnar nerve, that's going to start up here in that brachial plexus and come along the medial side of the arm. The radial nerve, that's going to be on the lateral side. The axillary nerve, that's the one that goes to your armpit. Okay? The median nerve runs in the middle. Okay? It is actually in between the radial and the ulnar nerve, just like a median in between east-west or north-south roads. And then we have this other one called the musculocutaneous nerve. Anybody remember what is referred to when we say the word cutaneous? We had a subcutaneous layer. What? Skin. So the musculocutaneous nerve is going to run in between the muscle and the skin. It is going to be superficial. Okay? And we will see that sort of on the superficial and sort of lateral side of the brachial region. But again, lots and lots more nerves that come from the brachial region. These just happen to be some of the ones that you need to know, not every single one of them. Now, you can damage your brachial region. If you damage your brachial region, you can stretch your nerves, you can pinch your nerves, you can crush your nerves. You're gonna have issues with your arm, okay? You may have numbness down your arm that may come and go. You may have weakness that sort of comes and goes, just depends on what's happening with the plexus. Okay, now, so we have our cervical plexus, we have our brachial plexus, we don't have one in the thoracic region, but then we have our lumbar plexus. And the lumbar plexus comes out between L1 and L5. Again, don't worry about the colors. You can look at them and marvel. And you know, if you decide to become a hand surgeon like the guy who fixed the girl's fingers, you would have to know things like this, but not necessarily for the lumbar plexus, for the brachial plexus. But lots of nerves that come from here. And these are just the beginnings of the nerves. These will then go down farther and branch and branch and branch, because we have to get nerves basically everywhere, okay? Because we have sensory receptors everywhere, and superficial and deep. And so we have to basically cover everywhere in the body with this electrical system. Now, we do have a couple of large ones. We have the obturator nerve. Where do you suppose the obturator nerve is headed for? What feature? The obturator nerve.
Obturator foramen.
Yeah, the obturator foramen. And so this, right, so that's that one. Oops, a daisy, wrong button, right? So this right here, that's the obturator, and it's coming down and it's gonna aim to go through this foramen. And so when it does, it winds up on the medial side of the femoral region. Now, again, as it goes there are going to be branches coming from the obturator nerve, and you can see it's fairly, I mean, it's not a tiny nerve, right? There are others that are larger, like the femoral nerve is much larger, because the femoral nerve is going to branch and branch and branch and branch and branch. So if you're going to branch and branch and branch and branch and branch, you need to start out with a fairly large nerve. So your femoral nerve is going to start, again, up here. We can see that right here. It is starting up here in the lumbar region, and it's going to come out of the pelvis. So, do you remember on the os coxa, you had the anterior superior iliac spine, and then the anterior inferior iliac spine, and then there was a little dip in between the two. And they basically, if you find your iliac crest and you follow it, as soon as it starts to dip, that's the anterior superior iliac spine. There's going to be a little dip, and then you're going to find the anterior inferior. Well, in that little dip, that's where you're going to find the femoral nerve. That's coming out of the pelvis. You can see it right there, but there's the little dip on the left-hand side too. So that's where your femoral nerve is going to run. You'll also find next quarter that is also where your femoral artery and your femoral vein are going to be as well, which is why this is known as a pressure point. Because if someone's bleeding, you can put pressure right there, and you can take the femoral artery and the femoral vein, and you can squish them between your hand and the bone, which is nice if they've just like cut off their leg or something. So, but this is the femoral nerve. This is the femoral nerve. It is one of the larger nerves in the body. However, it is not the largest. The largest comes from the sacral plexus. This is again, anterior view, and we are right here. This one right here, this is known as your sciatic nerve. And the sciatic nerve is the largest nerve in your body. I think we mentioned it. It's about 3/4 of an inch in diameter, which is about the size of the pen, right? The marker, which is pretty huge. And so this, scientists have identified that it down in the popliteal region, which we'll see in just a minute, it will split into two separate sections. We will have the common fibular division and the tibial division. So you can imagine where those are going to go. But again, we can see that this is coming from L4 all the way down to S4. And this is the anterior side. If we look at the posterior side, however, This is where the sciatic nerve runs. So your femoral nerve is the larger nerve on the anterior side of your femoral region. The sciatic is going to be on the posterior side. So we can see that it exits anteriorly, and then it comes down, right past the lesser trochanter. It pretty much hugs the femur, and it's going to have branches coming off as it goes down, but once it gets down here to the popliteal region, it is going to split into that common fibular and the tibial nerve. And then the fibular is going to go around the fibula and go down the rest of the way towards the foot. And then the tibial will come down all the way towards the calcaneus. This is why people who have sciatica, right? If you've heard of anybody who has sciatica, this is why they are in so much pain, because that pain starts up here and runs all the way down to their heel, right? And people will describe it as sort of like a burning sensation that starts up here, sort of where you keep your phone, and then runs right down the middle of the posterior of your leg. And some people have this constantly, which would be very uncomfortable. But this is the sciatic nerve, okay? Does that make sense? Questions? So we're going to change gears just a little bit. We're going to talk about reflexes. So we're going to see a lot of words on slides, but again, all the slides are on Canvas, so you don't have to write the words down that are on the screen. So a reflex. So on Monday, just trying to figure out when you were here last. On Monday, you did reaction time. So reactions are things that are learned. They become automatic, and they're learned. Like you duck when something's aiming for your head. When you were a little kid, you didn't always duck, and you ran into things, or things ran into your head, right? Those are reactions. Reflexes, they are also automatic responses, but we did not learn them. We did not learn them. We do these without conscious thought. These are going to be things like when you go into a dark room, your pupil expands. When you go out into the light, your pupil constricts. That's a reflex, and you're going to be checking your reflexes today by hitting each other nicely. Okay? Now, there is what we call the reflex arc, and this is the neural pathway. And so what happens is you're going to start out with some sort of stimulus. If you go out into the bright sunlight, it's going to be the bright sunlight. That sunlight is going to trigger a sensory receptor. Okay? We're going to have a sensory receptor. Depending upon the stimulus, that will determine the type of receptor. You've already checked out some receptors when you poked each other with hot and cold things. You checked out touch receptors. Okay? Hopefully not pain receptors, but you did some touch receptors, and that is a type of receptor. The receptor is then going to send information to the spinal cord, and this is going to be on a sensory nerve. A sensory nerve. Now, sensory nerves are made of sensory neurons. So a sensory nerve, we already know, goes from the periphery to the central nervous system. So we have our stimulus. It was picked up by a receptor, a sensory receptor. It then sent an action potential or an impulse to the spinal cord. Now, in the spinal cord, we have two options. And we're going to go with the one that is labeled up here on the board. In the spinal cord, there may be a short little neuron. It is known as an interneuron. And that is this guy right here. I'm going to put a question mark here because there is not always one. Sometimes reflexes don't have this. Okay? But if there is one, this typically gets the impulse from one side of the spinal cord to another. And then the interneuron is going to synapse with another neuron. This time, this is going to be a motor nerve. A motor nerve. And the motor nerve is going to go out to some effector. This is going to go out to some effector organ. And the effector organs are going to be glands or muscles, right? Could be skeletal muscle, could be smooth muscle, could be cardiac muscle, could be some sort of a gland, right? But this is known as the reflex arc, right? Because it looks like an arc. Now, do you notice anything about this? Do you notice a place we're not going? Not going to the brain. Yeah, reflexes do not need the brain involved. However, there may be another neuron that actually will carry information up to the brain for what we call perception. It is not necessary for the reflex to work. Okay? But if you say step on something very sharp and you automatically pull up your foot, right? That pulling up of the foot went from your foot to your spinal cord out to your muscles to move your leg. There was also another neuron that synapsed with that information that went up to your brain and triggered the ouch saying, okay? But again, this is not part of the reflex arc. Does that make sense? Okay, so again, we have our stimulus picked up by a receptor on a sensory nerve to the spinal cord. If there is a interneuron, we have to have a synapse there. There's another synapse here to a motor nerve out to an effector. Now, if there are multiple synapses, we call that a polysynaptic reflex. A polysynaptic reflex. Okay? And that means, one of the things that it means is it's going to be a little slower. Right? Because you already know what it takes to go across a synapse. We've already dealt with that in the skeletal muscle system. So here, we've got at least two of them if we use an interneuron. There are some reflexes where you get the sensory nerve coming in and it is going to synapse directly with the motor neuron. And in that case, there's only one synapse here. It is known as a monosynaptic reflex, and that is going to be faster. Now, in the nervous system, when we talk about fast and slow, we are still talking milliseconds. Milliseconds. Okay? So, but if you have a monosynaptic reflex that only takes 100 milliseconds, and you have a polysynaptic that takes 150 milliseconds, well, that's half again as long, okay, in the world of the nervous system. But for us, yeah, we're not going to be able to tell the difference between 100 milliseconds or 150 milliseconds, okay? Does that make sense? Questions? So, just a few reflexes that deal with the cranial nerves. Just the cranial nerves. So those 12 pair of nerves that come directly from the brain. And these are not even remotely all of them, okay? But for instance, the vagus nerve, cranial nerve number 10. The cranial nerve number 10, the vagus, it is the longest of the cranial nerves, and it comes down to your heart, comes to your stomach, and even down into your intestines. But it has a role in maintaining our heart rate, our blood pressure, and even our respiration. And so if there is a stimulus that goes to your spinal cord, and you can remember the vagus comes from your brain stem, and then you can send information out to any of these organs. You also have like turning to look at a noise, right? As we talked about earlier today, this is why we ask that people who come in late just sit in the back, because if you go up to if Logan were late and he came and even if he went around the long way, even if he was quiet, there's movement, there's a little bit of noise, and everybody looks to see who just came in. It's a reflex, right? Touch on the skin, right? How many of you have ever been standing and you feel a little tap on your shoulder and you look over and it's like there's no one there? And people think that's just so funny because they've done this to you, right? You can also do that to cats and dogs too.
Wait, really?
It's pretty entertaining, yeah. But it's a reflex, right? You feel and then you automatically turn towards where you felt that. Even if it's just a light brush of the skin, it's like, oh, what was that? Was that a bug? Right? Was that a bug? That's not part of the reflex. That's that secondary neuron going up to your brain and going, something's crawling on you. Yeah. Again, we have all sorts of reflexes. The second one, eyes tracking a moving object. This is a cranial nerve. This is your oculomotor nerve. And this is very telling. So if you have had some sort of a head injury, if we want to see like how bad it is, or if really you injured anything inside your skull, that you do a whole bunch of tests, really simple tests. You're going to do them in lab today. This is the one where if you've ever been to the doctor and they say, okay, look at my finger, and without moving your head, look up, look down, look right, look left, Can you do it? Well, if you can, that means that at least one of your cranial nerves is functioning, your oculomotor. Right? It means that pathway is A-OK. Cranial nerve testing is really diagnostic. It's very, very helpful. As opposed to if you say, oh, my big toe hurts constantly, and there's nothing on the outside to say that you've injured it or anything. If it's a nerve issue, you have from your toe all the way up to your brain to try and figure out where's the problem. So we like testing our cranial nerves. This is a nicer diagram of our reflex arc. So the reflex can interact with the spinal cord and then also send sensory information to the brain, and then send the effector out. So here is the sensory receptor out in the skin. This one would be like for light touch. That comes in through that dorsal nerve root and the nerve root ganglia. And oh look, it came in through a little rootlet. And then this one has an interneuron. So this particular reflex is going to be slightly slower than one that only had one synapse. It synapses with the interneuron and then synapses with that motor neuron out through the anterior or the ventral nerve root, and then out the motor neuron, and then the motor nerve to whatever muscle is close. And this one would be, if this were in your hand, this would more than likely be your biceps brachii or something of that nature. So this is your reflex arc. Any questions? Any questions? All right, so we need to switch chapters, so let's take our break a little early. Let's come back at 10 till. Looks like that gives us about 10 minutes. So stand up, move about, we get some blood to your muscles, and then we will come back and start looking at more of the nervous system.